what is PET scan, how it is different from other routine scans like CT and MRI, and is it required always for diagnosis of cancer? So these days we see number of patients coming to our OP asking themselves, sir, I just want to get a PET scan and check my body thoroughly from head to toes, that whether I have got cancer in any parts of my body. So is it correct? No, that's not the right thing to do. So how PET scan is different from other CT scan and MRI scans? CT and MRI are usually structural scans. Like for example, one is able to see liver whether it's normal or not, or it has got any other tumor in that, and what is the character of the tumor. Like we inject something called as a contrast, and that contrast will give some character to the tumor. Depending on the character, we can classify the tumor as a cancerous tumor, non-cancerous tumors, and different kinds of subtypes. Now this is what happens in CT and MRI. So they are structural scans basically, whereas PET scan is called as functional scan. Means the dye injected for a PET scan, it is actively taken upon by cancer cells and highly metabolizing cells like infectious cells. So not just cancer cells, infectious cells also take them. So that doesn't give an idea about the size of the tumor or where the tumor is located in the liver. For example, liver is such a big organ, it can be located at multi different portion. It will not exactly give that it is located in such a distance from an important blood vessel or so. It can just tell that there is a tumor like thing in this portion of liver. It will not tell exactly what is the size and what is the distance from important structure. Now to get the benefit of these two, what we do is called as a fusion scan, it's called as a PET CT scan. Whenever a PET scan is combined with a CT scan, we get the advantage of both. The function, whether a tumor is present in the liver, if it is present, whether it is a cancerous tumor or a non-cancerous tumor, this will be told by PET scan, and CT scan will give us an idea about the exact size of the tumor and how close it is present to an important blood vessel or so. But what actually in reality we get is the CT scan which is combined with the PET scan, the details of the tumor will not be as good as a routine, a good quality CT scan, because a good quality CT scan is something above 64 slice CT, like 64, 128, 256 slice CTs are used, whereas in PET CT it is either 8 or 16 slice CT. So the resolution of the tumor of a CT when it is combined with PET comes down. Nevertheless, if we want to get an advantage of both the scans in a single study, then PET CT is the investigation of choice. But on the other side, PET is not taken upon only by cancer cells, it can be taken upon by inflammatory or infectious cells also, and rarely some 20% of the kinds, depending on the subtype of cancer, even some cancer cells like mucinous cancer, signet ring cell type of cancer, these are some special types of cancer which will not take PET CT. So we suggest patients not to undergo PET CT by themselves. Do consult a doctor, find yourselves whether you are an appropriate candidate for a PET scan, and if PET scan is suggested, it's always go to get a PET CT done. These days we also get a PET MRI, which is upcoming investigation with a slightly better resolution. So never ever you go yourselves get a PET scan done, and that may sometimes show small nodes in the chest which can be due to an inflammation or infection also. But on the other hand, it will give an unnecessary thought in your mind that okay, I have got a cancer in my chest. So without consultation of doctor, don't interpret PET CT also, and without consultation of a specialist, don't undergo PET CT scan by yourselves. Thank you.